Movement builds rhythm. Rhythm builds control. Control builds confidence. For some, it shows up in sport. For others, in the work they return to every day. And then, one injury changes everything.
3 months back, I was not like this. I was on a wheelchair.
A grade 3 tear of the medial collateral ligament, severe instability, pain on movement, loss of confidence in the joint.
I was not able to stand and bear weight on my right leg. Even going to toilet and basic needs was getting very difficult. I was not sure whether I'll be back to normal ever again.
So he arrived here on wheelchair, wearing long knee brace, and he took the assistance of walker from wheelchair to the bed, and we aim at his pain reduction, his mobility restoration, and to enhance his stability.
So this is the MRI report of Dr. Sanjay Wazir, who came to us with an injury in the MCL, that is medial collateral ligament, and it was in the complete cut grade 3 injury. The people who have grade 3 injury, it is very difficult to get in healing 100%. But with the right manner, right way, phase manner treatment, we achieve the best results. We structured a plan in phases manner, which is very important in such kind of patients. So where we work on the protection, we focus on the activation of the muscles, we focus on the strength, and we focus on the function so that we can return him to the normal sports.
Early focus was pain control and mobility. Then controlled activation. Strength building followed. Finally, movement under load and agility.
Very nice. Excellent. I could feel difference every week, and now I'm almost 90% better.
From assisted movement to controlled running in 2 months.
Pain resolved, stability restored, and now we are building up his performance so that he can back to his game. Not only the golf, but he can play other sports like hockey, football, etc.
Recovery is not just absence of pain. It is returning to life as it was.
And now I am back to my routine, back to my game.
Physio Active, where hope meets healing.